I'm here again today with Bonny Specker, epidemiologist from South Dakota State University, who is going to talk to us about what's going on with COVID-19 in our area and in the world. And also today she's going to give us a mini lesson on what does it mean to be recovered from COVID-19. Bonny, what does that phrase mean?
Well, it depends on what you look at. The dashboard that the Department of Health provides enough information to make this graph. This is a graph that's included in those daily updates. And in this graph, we show the number of active cases, which are still increasing, but we also have these recovered cases. And some people think that this means recovered, but I thought it would be good to go over what the actual definition of recovered is on that website. Both the Department of Health and the CDC have a pretty strict definition of recovered, and that's that you're at least 10 days out since your symptoms started, and that there's at least 24 hours have passed since your fever went away, and also that other symptoms have improved. So if you're still in the hospital and you're, say, 2 weeks out, but you're in the hospital, you wouldn't be considered recovered because your symptoms are still bad enough to keep you hospitalized. But if you had multiple symptoms and they've gotten better, but you still have some of them, so you're not completely recovered, according to this definition, you would be considered recovered. And there's now some evidence out there about this term long COVID, and people are using it to describe people that have recovered from COVID but are still showing some sort of lasting symptoms or effects. And it also describes those people who have had the usual symptoms far longer than what would be expected. Now, there are some studies suggesting that this long COVID does exist, and probably one of the most important ones, or the best of the studies, is a study of hospitalized COVID patients 60 days after their first symptom. This paper is reported in the Journal of the Medical Association, the American Medical Association, JAMA. It's a study that was completed in Italy with 143 people, and they had a mean hospitalization period of close to 2 weeks. It is a peer-reviewed scientific journal, which gives it some more credibility than articles that are not peer-reviewed. But that particular study found that 2 months out, 13% of these patients were free of symptoms, but 87 of them were still experiencing at least one symptom. 32% of them had 1 to 2 symptoms, and 55% had 3 or more symptoms. So this is 2 months out, and by definition, these people would have been recovered according to that CDC definition, but you can see that they do have persistent symptoms. In this same study, these patients, none of them had fever or any other signs or symptoms of that acute illness that you see when you first get the virus. And the most common symptoms that were reported was fatigue by 53% of the people, loss of taste or smell, joint pain, chest pain. 40% of the people actually reported a worsened quality of life. So their quality of life was not good. There's another study out there called the UK COVID symptom study. And this study is a little bit different in that it is using an app that tracks symptoms. And people in the UK, Sweden, and the US have this app on their phone, and they record how many or what symptoms they have each day. So it's not quite as strong of a study because who is it that gets this app? There's what we call, there could be a selection bias in that. This was published just this last week, but it has not yet been peer reviewed. So it's a very preliminary study. But this particular study found that close to 87% of individuals had symptoms for 4 weeks or less. 13% had symptoms for more than 4 weeks. 4.5% had symptoms for more than 8 weeks. And 2.3% had symptoms for more than 12 weeks. So that adds up to more than 100, because that 13.3 includes the 8 and 12-week individuals as well. The symptoms in this study, that the most common ones were fatigue, headache, shortness of breath, loss of smell, and a persistent cough. Now there's a couple other studies that are out there. There's one that was done in the Netherlands and Belgium that looked at both hospitalized and non-hospitalized individuals who reported multiple symptoms 3 months out after the onset of infection-related symptoms. And then another study out of France looking at, again, hospitalized patients, and they had symptoms almost 4 months out, including fatigue, difficulty breathing, loss of memory, concentration issue, that brain fog that people you might read about in the newspaper, and then also sleep disorders. And just a reminder, back in April, Chelsea, we did that one talk on the cardiac, long-term possible cardiac effects. So we've talked about that before, and the video is on the city website. But in summary, this COVID is a new disease, and we're still learning a lot about it. Some of the studies about the long COVID are preliminary, and based on these select populations are relatively small sample sizes. And we really need further studies to determine when people actually recovered from COVID, and why do we have what appears to be long-lasting symptoms or effects from being infected with this virus. For many people, it does appear that it is much longer than just 10 days after the first appearance of symptoms that they still do not feel 100% better. So it does appear that there may be something with this long COVID, but we're just not sure at this point in time how serious it is.
Well, thank you, Bonnie. I appreciate the update on that. It'll be interesting to see what happens over time so we can know more about the virus and what recovery actually means. So what else do you have for us today? What has been going on with COVID-19 locally, maybe in our state, nationally, and in the world this week or over the last week?
Well, I did this as of yesterday. It's a little bit easier to find the time to do it through Sundays rather than Mondays. So in Brookings, as of yesterday, in the previous week, well, in total we have 1,380 cases, 181 cases this week compared to 215 in the previous week. So we have dropped a little. I put that cases in yellow because that's what the graph is showing, is the trend over time. It's impossible to read the footnotes on this graph, but again, this graph is taken from the daily data report, so you can see it bigger in that report. There are 382 active cases. This is a record high on October 25th. 40 people total have been hospitalized. There have been 10 new admissions this week compared to 11 in the previous week. There have been 4 total deaths, 2 of them this week. We are still in substantial community spread, and we really need to get to less than 34 cases in any one week to get that down to moderate. The test positivity among people tested continues to be high at 29%, and again, we want that below 5% to say that we have this somewhat under control. So in South Dakota, there were 39,000 cases total, 5,934 cases this week compared to 4,705 cases in the previous week. As of October 25th, there were 10,745 active cases. There have been a total of 2,436 people hospitalized. 317 of those were admitted this week compared to 253 in the previous week. As of October 25th, there are 366 individuals hospitalized with COVID at that time. 375 total deaths. 52 of those deaths occurred this week compared to 37 deaths in the previous week. Test positivity among people tested continues to be high at 40%. And again, the WHO recommends that to be less than 5%. All of these numbers are record high numbers, either for the number or the 7-day average. So it was not a good week in South Dakota, a better week in Brookings. The South Dakota school situation, this yellow line with the pink dots, the 2,502 cases of COVID among K-12 students. And the teachers are the yellow line with the red dots. Those are the K-12 staff, not just teachers, but the staff. As well, 1,050 cases there. Higher education students is the blue line with the pink dots. There are 1,742 students in higher education that have tested positive for COVID, and 153 higher education staff people have tested positive. So that's statewide, not Brookings, it's the whole state. In the US, there have been 8.83 million cases total, 485,000 new cases this week compared to close to 396,000 in the previous week. The graph is of the newly diagnosed cases by day, so you can see that it's going up. We are actually now higher. That 7-day running average is at a record high. There were 230,000 total deaths in the United States. 5,786 of these deaths occurred this week compared to 5,000 in the previous week. Globally, there have been 42.92 million cases, 2.98 million cases this week versus 2.48 million in the previous week. This slide actually is the number of confirmed cases by day. It's not a cumulative number. So you can see that it's been increasing pretty steadily throughout this pandemic. We have 1.15 million deaths, 40,000 deaths this week compared to close to 37,000 in the previous week. So both of these are going up. It is known, I mean, people expect this to go up in the fall, to get worse. So it's really important to follow public health recommendations. The travel restrictions are still the same as they have been each week. The states that limit travel or require quarantining, you know, that's not going to change for South Dakotans until the test positivity rate gets down in the 5% or lower range. Because most of these states do base travel restrictions on the test positivity of where you're coming from. So it's important to remember that to protect others, you need to wear a mask, socially distance, and get tested if you have symptoms or are a contact of a case.
Well, it's been a tough week, but thank you, Bonnie, for the update. I appreciate knowing what's going on. And I'll talk to you next week. Thank you, everyone.
Thanks.